Welcome to the second module in the Mid-Level Leaders in the Transition to Value program. We hope that since the first module, you've had some valuable conversations with your colleagues about the transition to value in your facility. This month, we'd like to build on the concepts covered in the first module by exploring what it means to be a strategic thinker and systems thinker in your role, and how these types of thinking can positively impact your organization's journey to value. Just like last month, you'll hear other hospital leaders share their perspectives on these topics, and we'll leave you with a few things to explore and pay attention to between now and the next module. So let's get started. Let's start with systems thinking. Systems thinking can be defined as seeing the big picture, understanding the connections between things, and knowing how a change to one of these things might affect other elements of the system. One of our favorite ways to talk about systems thinking is through the story of the blind men and the elephant. In this story, a group of blind men come upon an elephant and set about trying to figure out what it is. One man feels the elephant's leg and says it's a tree. Another feels the trunk and says it's an enormous snake. A third feels the tail and says it's a rope. The moral of the story is that we each see only a small proportion of the larger picture when we rely only on our own perspective. It's only when we take a step back and work with others to pull diverse perspectives together that we truly understand the larger system. Merriam-Webster defines a system as a regularly interacting or interdependent group of items forming a unified whole. In healthcare, systems thinking is more critical than ever because of the holistic view of health that the transition to value is based on. We can think about a community's healthcare system as involving not just a hospital and clinic, but also schools, behavioral health providers, social service agencies, businesses, the faith community, paramedics, libraries, and multiple other entities. They're all interconnected, where a change in one impacts the others. For example, if a large employer opens a manufacturing facility in a rural community, the hospital, clinics, and mental health providers may need to prepare for an influx of new residents in the community. Or consider a community that experiences a large number of teen suicides in a given year. The school system might work to provide education programs for staff and students. Social service agencies, faith-based organizations, and mental health providers would likely be mobilized, and medical providers and emergency departments might choose to incorporate behavioral health screenings into patient visits.
Our vision for the future is to be the best. So really just to be that premier health delivery model. What that used to mean was, maybe we're going to take care of patients and it's going to be an excellent experience with great quality, high quality outcomes, and that certainly is still a part of it. But being the best these days means so much more than that. It means getting together with community stakeholders and making sure that you're not duplicating efforts. It means addressing issues in the community that are impacting somebody's overall health. It means recognizing if there are substance abuse issues or mental health issues and addressing those. So being the best is way different than I would have defined being the best some years ago. Just as we make this move to value and population health, we really need to get a better understanding of what does best look like. And then that means having conversations with the community to find out what does best look like to them. How do they believe that the care should be and health should be delivered? And then, meeting those people where they need to be or want to be met, and involving other folks, public health, other area licensed mental health practitioners, schools, foundations, just the whole host of stakeholders that you might find, religion, so faith, friends, all of those things come into play when you're talking about being the best. And so our vision is to be the best, and that's sort of what encapsulates for us being the best.
Systems thinking can also help you understand the interdependence across departments within your facility, see how you and your department fit into the big picture, and think through how a given decision might impact others in the organization, as well as the patients you serve. In your role as a leader, the more you reach across departmental boundaries to learn about other departments' priorities, processes, and challenges, the greater the ability you'll have to understand how a change in one part of the organizational system might impact the rest of the system. Understanding the larger system can also help you communicate more effectively with senior leaders in your organization. Because senior leaders are responsible for leading at a system-wide level, they tend to take into account the entire organization when making decisions. The more you can demonstrate your understanding of the broader system and tailor your messaging in ways that illustrate the impact that any of your proposals will have on the entire system, the more likely it is that your message will hit home. This is really one of the things that distinguishes the most effective mid-level leaders and that positions mid-level leaders for promotion, when you can demonstrate your system thinking and make decisions based on their impact on the broader system. There are a lot of tools out there to help you develop your systems thinking skills. You can find many of these tools in the resource guide that accompanies this series. Here, though, are a few things you can start with. First, make a commitment to learning throughout the course of every day. Ask questions, stay up to date on trends and current thinking, and support the learning of others. We'll come back to this topic in detail during Module 3 in this series. Second, be prepared to be wrong or not to know the answer. This may sound like an odd recommendation, but the more we can keep ourselves open to new ideas and different ways of learning things, the better we are at seeing new connections and possibilities. And last, work to bring different people together who have different perspectives and who see different parts of the system, to help the entire group see a fuller picture than any one of them see on their own. We'll come back to this in Module 3 as well. Let's move to talking about strategic thinking. Strategic thinking happens when we make decisions and plans by taking into account our long-term goals and potential changes in the environment. For example, many leaders of healthcare organizations have historically made decisions that help their organization achieve a strategic goal of increased volume. In today's landscape, however, leaders navigating the shaky bridge to value-based care have changed their thinking and are now gearing their plans and decisions toward efforts to improve population health and wellness. These types of decisions often result in decreased volume because these leaders are thinking about the direction that healthcare is moving and what's most likely to maintain their organization's financial strength into the future. While in your role, you may not be directly responsible for creating your organization's strategic plan, you do play a key role in ensuring that the strategic goals are met. You're responsible for carrying out the strategy in your area of responsibility, making decisions that support the strategy, and ensuring that those who report to you not only understand the organization's long-term strategy, but also the specific contributions they make to these goals. In order to do all this, that means, of course, that you must fully understand your hospital's strategic goals, and specifically how you contribute to them. If you're thinking, I'm not sure I know as much about this as I'd like, don't worry. At the end of this module, we'll give you some specific things to do to help you get the knowledge you need.
Well, first and foremost, mid-level leaders need to understand the why behind the strategy. And if they're unsure or can't articulate it to others as they attempt to influence others, they have to be comfortable to ask why. People who are unsure about what they're doing have a much harder time convincing others to accomplish those goals. They need to be able to articulate that why and really help sell it to other folks. And they need to be a connector. They need to bring feedback back to senior leadership. In one case, if there are provider concerns, they need to bring it to providers. If it's patient concerns, they need to bring it back to interdisciplinary teams that are working on the objectives that we've got. So really being a communicator and a relationship builder is vitally important for mid-level leaders in care coordination process and the value equation.
Certainly, I like our mid-level leaders to be owners because then they have a stake in the organization and they take pride in their performance and our outcomes. One thing I don't want them to do is say, Joanne said. So they have to believe in it and they have to actually communicate that. It's not me as a CEO saying it or driving it. It's them as their supervisor or manager leading it.
So, putting strategic and systems thinking into the context of the transition to value and population health. One way we can use systems thinking is to understand the diverse entities or stakeholders that make up the healthcare system. And one way we can use strategic thinking is to identify which of these stakeholders have perspectives that need to be included if we are to achieve our long-term goal of population health. You may have noticed that both of these examples require working with other departments and other organizations. In your role, you play a key part as a boundary spanner, someone who can reach across boundaries inside and outside the organization to strengthen connections and build understanding across the different parts of the system.
Mid-level leaders have to build collaborative relationships. That's inside the organization. They have to think outside of their role or their department. We have to remove the silos so we can look at care across the continuum. They also have to develop community relations, because as we go to the community and have the community partners and leaders assist us in improving population health, we have to build those relationships and those collaborative opportunities to actually be part of the community.
Well, relationships really are a big part of what value-based care is about. For mid-level leaders, first is they have to have an ability to work within interdisciplinary teams. No one area of any organization can do this on their own. That's the concept of care coordination, helping us deliver the best value and the most seamless experience for patients and their families. Being able to work with other agencies within the community, Department of Health, Social Services, housing units, long-term care, educational organizations are important as well. And they have to have the ability to influence others. Concept of motivational interviewing is something that we teach our nursing staff and our care coordinators to help get the patients to move beyond what they think they can do or what they've historically done. And the why behind all of these things is that's the only way we're going to end up making the change and gaining the full measure of the value opportunity is if we can get people to move beyond what they think they can do.
Inside the system, however, I've always had relationships with the department leaders. I feel like that's just something that you build over time when you have a culture that is similar. Those that aren't similar don't usually stick around. So I think those relationships are very easy to build and they just happen over time.
Building relationships, especially inside and even outside of the organization, specifically at Tri-County Healthcare, is really one of the main tasks and intentions of my job. So I'm the care integration manager, and oftentimes when I say that, people kind of look at me and maybe don't quite understand what that means. And so when I explain it to them, it's really kind of helping support the work of the support services for patients in the healthcare facility where the departments and the patients are in both the outpatient setting and an inpatient setting. And so a lot of my work goes back and forth between the departments in the facility at Tri-County, and naturally those relationships have just formed amongst myself specifically, but then also with the employees who report to me. It's just been great to see how they have a team approach to where the patient receives their care.
Community care coordination is an excellent example of a population health initiative involving a significant amount of working across boundaries inside and outside the hospital. Stratus Health defines community care coordination as a partnership among healthcare professionals, clinics and hospitals, specialists, pharmacists, mental health professionals, community services, and other resources working together to provide patient-centered, coordinated care. Community care coordination activities often focus on addressing the disproportionate health outcomes that adversely impact underserved and vulnerable populations. While community care coordination has been shown to significantly improve outcomes for target populations, it requires leaders to do a lot of work bringing people and entities together to develop new processes, new workflows, billing arrangements, and much more.
Well, this is one of the key principles related to what we're doing here at Tri-County. The care coordinators really are the linchpin, in my opinion, to gaining the improvement in everything that's part of the value equation. They are the connectors of the patients to the providers in a lot of cases, the patients through the system to external agencies. For us, care coordination is part of what we call our interdisciplinary care integration team, which includes social services, some of the outpatient services, and they have those connections to our outside agencies and other organizations. Another big part of the care coordination role for us is community paramedics. We have been using community paramedics for many years. I characterize them in some ways as the boots on the ground for the care coordinators. Even though the care coordinators have close contact with the patients, they don't always have the ability to see what's happening kind of behind the screen, if you will, or on the other side of the camera, as we're starting to do some telehealth and televideo work with our patients on this. The community paramedics are a vital resource to help the care coordinators really understand what's behind the scenes to help bring that value equation. So for us, care coordination is not just the care coordinators, it is a large team of folks. The impact that our care coordination program and the care coordinators have had on patients has been profound. We certainly can demonstrate in our Medicare Shared Savings Program that we've got that we have achieved our goals. We've been able to improve our quality scores, improve our patient satisfaction scores, as well as reduce our overall spend within the Medicare eligible patients that are within this. So we're seeing it objectively there. But I think it's the subjective stories that tell the best story and have the best example. We have one of our patient champions who engaged with care coordination at about the age of 58, thoroughly anticipating that he would follow his parents to his grave by the age of 60. Significant health challenges, and he got engaged with the care coordination program and has recently celebrated his 63rd birthday and is a key spokesman for us out in the community about the great value that it can bring. We have another story that also one is really a life-saving example. And this is as much about our community paramedic program as it is the care coordinators. In that we had a patient who was in and out of jail, in and out of our ER, regularly brought to our ER by law enforcement, and communicated to us at one point that law enforcement expected that this gentleman would not be alive in the following year because he would probably have to be shot by police because of his behaviors and his challenges. So we got him engaged with our care coordinators and community paramedic. A year later, in a regular touch-in that we do with law enforcement, they asked about this gentleman and said, well, he must have left town because we haven't heard anything about him in the last 6 to 8 months. And as it turns out, he was still in town. What we've been able to do is help him stay on his meds so that his behavioral health challenges were more manageable. And it turns out, again, a life-saving as well as a significant improvement in his lifestyle and the value of the care for the Medicaid program who was caring for him.
I think coordinating care for patients and inside the facility and then while they're at home or if they receive home care services, I think that's been going on for a really long time at Tri-County. And so I always like to remind people that you've been doing this for a really long time and you've been great at doing it. We just need to expand what we're doing for those patients and whether it's a disease state or it's something that's been determined, transportation maybe, or higher levels of care, different services, healthcare services that they could provide, access to food, social supports for those patients as well. And so I think just having everybody understand and, like I said, kind of remind them that we've been doing this. It's just, we take recommendations from the Minnesota Department of Health in order to kind of just provide education and support for patients and our healthcare workers so that they can, provide good education to patients. So, social workers, dietitians, nurses, community paramedics, respiratory therapists, behavioral health folks, all those people really should be considering themselves, care coordinators and coordinating care for patients, and they do it in their own way.
In the next module in this series, we'll dig deeper into what it takes to work across boundaries, and explore things you can do to build your collaborative leadership skills. Between now and the next module, we encourage you to reflect on these questions on your own and/or discuss them with your colleagues to help you think through how the information covered in this module applies to you and your organization. How would you define the healthcare system in your community? What other organizations would you include under this umbrella? How closely does your hospital work with these organizations now? How much do you know about what these organizations do, and how can you learn more? How well do you understand your organization's strategic plan? How well do you understand your role in it and how each person who reports to you contributes to it? How well do those who report to you understand their role in it? If more knowledge is needed, how can you learn more? What departments or people in your hospital would it be beneficial for you to collaborate with more? How can you make this happen? What types of care coordination activities are currently happening in your hospital? What entities are involved in coordination? How are the populations chosen and what outcomes have resulted? And here are some things you might consider doing between now and the next module. Think of a change you've recently made or are about to make in your department. On a piece of paper, map out the individuals, groups, events, or processes affected by this change. Then add to your map the driving forces behind the change, any individuals, groups, events, or processes that made the change necessary. Expand your drawing out as far as you can, then step back and admire the system represented on your map. There is an example of this in the resource guide for this series. Have a conversation with your manager about how they view your role in the hospital's ability to successfully achieve its strategic goals, and about any relationships inside or outside the hospital that would be beneficial for you to develop in order to achieve strategic goals. If you aren't very familiar with care coordination initiatives taking place in your facility, reach out to those responsible for these activities to learn more about them. For additional information and resources on any of the topics covered in this module, see the resource guide that accompanies this program. And of course, please feel free to contact us at the center anytime for additional support. And we have a request. We need your feedback. On the main webpage dedicated to this series, there's a Give Feedback link. At any time during the course of this series, or even multiple times, please go to our website and share what was valuable for you and any suggestions you have for making this series better. We thank you for joining us today, and we look forward to continuing the conversation over the next few months.